I should start, but there is no cure. But I'm going to talk about everything we're trying to do in the world of food allergy. So, as Dr. Hernandez was saying, with OIT, patients on OIT might achieve desensitization, but there is a high rate of allergic reaction. Therefore, people have started thinking about how they can administer OIT or any kind of food immunotherapy in a safer way. One way would be to add something in combination with OIT to suppress the allergic reaction. And you have Xolair, the probiotics or yogurts, and the Chinese herb. Another way would be to deliver the allergen food through another route, such as the skin, and that's called APIT or the patch. So first we're going to talk about this point one, which is what can we add to OIT to make it safer. So first, Xolair. Dr. Maggie already summarized that when someone with food allergy ingests an offending food allergen, the food allergen will bind to the free IgE, and together they will bind to the surface of a mast cell, for example, which will become activated and will release histamine. The release of histamine will be responsible for the allergic reaction, such as a hive, urticaria, or systemic reaction. Omalizumab or Xolair will bind to the free IgE. So if, let's say, you eat something you might be allergic to, the allergen might not be able to bind to the free IgE, which is already bound to the Xolair, therefore will not bind to the surface of the mast cell, and the mast cell will remain inactivated. A few studies have studied omalizumab in combination with OIT. So Dr. Hernandez summarized already how OIT is working. But what you need to know is on the first day, the child is usually, or the patient is usually challenged to a dose of, let's say, peanuts, if he's allergic to peanuts, and it's going to be increasingly increased until they react. Patients who have been treated with Xolair prior to start OIT have been shown to be able to tolerate a higher dose of the offending food allergen and have less allergic reaction. So that's it for Xolair. There was one study that look at probiotic or kind of like yogurt add to the OIT. They studied the probiotic Lactobacillus ramosis. 62 patients were treated with the probiotic together with OIT for 18 months. When you look at the result at first, you're like, wow, in the patient on both OIT and probiotic, 90% of them were able to achieve a desensitization to 4 grams of peanuts. But however, when you look closely, you realize at first the group control was actually only placebo. So you had 2 groups. One was on OIT and probiotics, and the group control was on nothing. So it might be better to be on OIT and probiotic compared to nothing. And 2, as we said in the previous slide, usually you always start by a food challenge to see at which dose you're going to react. In this study, 60% of the patients didn't have a food challenge to start. So they were able to tolerate the food challenge at the end of the study. Maybe they were able to tolerate at the start of the study. The last adjunction or add-on is a food allergy herbal formula 2. And I was just showing you that it's a combination of 11 Chinese herbs. 3 clinical trials have been performed so far, and they were able to show the safety and the fact that it was okay for the patient to take it. However, on the first trial, each patient had to take more than 20 pills per day and got a lot of abdominal symptoms. It's now, there is a study going on, and the number of pills is lower than that. So if we summarize this first part in terms of what could we add to the OIT in order to increase the safety, I would say that a combination of OIT and Xolair enhance safety, but doesn't appear to increase the efficacy. The probiotic and the Chinese herbal medicine added to the OIT are under investigation, and I think it's too early to say much. So we talked about the second way, which may be to use another route to deliver the allergen, and the skin was chosen, so it's called APIT or patch. Why the skin? It's because on the surface level of the skin there is no vessel. So if there is no vessel, theoretically there is less risk of systemic reaction. In the next 3 slides, I'm going to go over the clinical trial that was done on patch. The first one is the phase 1, which is usually to see is it safe to administer a patch in, for example, children. So it was studied in both children with milk allergy and children with peanut allergy, and in both cases, the patch was well tolerated. The phase 2 is not only looking at how safe it is, but how it works and the efficacy. So they treated 74 patients with peanut allergy for 52 weeks, and they used 2 different patches, one at 100 micrograms and one at 250 micrograms. And the success of the study was if they were desensitized, which means they were able to tolerate a 10 crus increase in their successfully consumed dose. And as you can see, in the active group on the patch with 100 or 250, the percentage of desensitization was significantly higher compared to the control group, as it's shown here. However, and you might have heard about this trial, which was published last year in JAMA, a phase 2b trial looked at more patients, 221 peanut allergic subjects. They were treated for 12 months with either a patch of 50 micrograms, 100 micrograms, or 250. And this study, what was interesting is only the patient on the patch at 250 micrograms of peanuts got a better result than the placebo group, as you can see here. So what was extremely surprising in this study is if you look at the control group, 18% of them got desensitized. So they had a food challenge, they reacted to the peanuts at a certain dose, they were placed with a patch which has nothing on it, and then 12 months later, they were able to tolerate a higher dose of peanuts, and no one knows why. So we talked about what we could add to OIT to make it safer, and then I introduced the notion of patch. For the last 2 slides, I just wanted to compare side by side OIT versus patch or EPIT, so you can get a better idea if you start thinking about it. So I think the main thing is with OIT, as exactly Dr. Hernandez was saying, the quantity you can be desensitized to is 300 to 4,000 milligrams of protein. If we're talking about patch, it's only 50 to 500 micrograms. So there is at least a 12 to 120-fold increase with OIT. The number of food allergens studying with OIT are it's broader with OIT compared to the patch. So with the patch, you only have peanuts and milk so far. That's number 1. Number 2, and I think Dr. Hernandez mentioned that already, because you have a higher dose of allergen and because it's an oral route, the safety is actually less desirable compared to the patch. And you have frequent adverse reaction. Some of them are systemic, and exactly as Dr. Hernandez said, it can be increased with exercise, fever, menstruation, or empty stomach. But most of the side effects are abdominal pain and nausea, and as exactly you mentioned, it is a risk factor for stopping the trial. And if you stop OIT, then you lose what you were able to gain, because very few of them, as you heard tonight, if you stop it, you lose it. Only a few percent will be able to maintain their desensitization. Finally, it was already mentioned, but it's true that some people on OIT have been described to have the eosinophil in their esophagus, which is an inflammation, from 2.7 to 8%. This 8% might be a little bit high, and there was a few limitations with the study. If you decide to have someone on OIT, then when you give the dose for 2 hours, the child should not be on any physical activities. Finally, the patch seems to be working better in younger children from 6 to 11 years old. And we talked already about that. So usually you can be desensitized, I mean you have to eat the food every day and you won't react to it, but if you stop eating it, you're less likely to not react to it, so you might react to it. So as a conclusion, I would say that most of the patients treated with OIT will achieve desensitization. As long as they eat the food, they will not react to it. But a few of them will reach tolerance, mean if they stop eating the food, they might react. The combination of OIT and Xolair enhances safety of OIT, but doesn't seem to have any effect on efficacy. The probiotic in Chinese herb, I think, as adjuvant to OIT, I think it's too early to say anything yet. And if it seems to be safe and well tolerated, it seems to have been working on the phase 2, but on the phase 2b was not working as well. So I think more study needs to be performed. Thank you.